Yeah, so as mentioned, this panel is on alcohol, violence and harm. I just wanted to say a little bit before I start. Quite often through my presentation, I'll use the term alcohol-related violence, but really that's kind of a shorthand and also slightly led by the terminology in the available statistics and kind of official data. But that term is not meant to suggest that alcohol always leads to violence. Alcohol is the primary cause of violence when it is in part of the mix of any incident, but only that it's a contributory factor in some of these incidents and that it's involved in that way. So if you can excuse my shorthand, that's a little health warning just before we start. But if we begin in England and Wales, alcohol-related violence is a significant harm. So the association between alcohol consumption and violence is fairly well established. We know, for example, that on the kind of national level, as alcohol consumption and availability rises, so do levels of violence. And this is data from the Crime Survey for England and Wales. This is a victimisation survey conducted every year, asking people about their experiences of crime. And as you can see, alcohol-related violence in total has kind of fallen over the last 10 years, but that's pretty much in line with violence overall. However, it's pretty steady in the last 4 years, sitting at around 500,000 incidents every year. So this is where the person who was a victim of violence has described the people involved as, in their opinion, being under the influence of alcohol. So there's some subjectivity here, but obviously it's a measure we've had for a long time, so there's some consistency in these kind of patterns in that way. And most of the responses to alcohol related violence are rooted in the criminal justice system in England and Wales, but this is also true in other contexts, as Madeline is going to be able to speak to after me. So the kind of policy initiatives that we see most often when it comes to things that are specifically kind of named as targeting alcohol-related violence would be things like policing operations in the nighttime economy, enhanced custodial sentences for violence committed under the influence, or a really recent example is sobriety tagging. So these are little pieces of wearable tech that monitor a person's alcohol consumption through their sweat. And these were rolled out in England and Wales just a couple of years ago. And there was recently a question in the House of Commons about these, and I believe they've already rolled out twice as many as was their target for the end of 2025. So these have been, the uptake has been kind of staggering. The kind of adjacent point here is that responses are not only just rooted in criminal justice systems, but they often focus on these nighttime economy spaces. So they focus very much on public drinking and on-trade sites, so bars, clubs, those kind of entertainment districts, rather than necessarily thinking about alcohol sold through supermarkets and shops and other kinds of sales site. But obviously, as I'm sure many of us are aware, if we're attempting to address alcohol-related violence as a harm, we really ought to be considering the other kind of side of that equation, which is, are there harms that our policy interventions might be aggravating or introducing? And as we know, criminal justice systems produce harm, and they also entrench various inequalities. I'm not going to go into too much depth about that literature, but I wanted to highlight a few recent examples, specifically relating to alcohol, to show how this kind of might happen. So the first is aggravated offences. So this is where you are given a harsher sentence because in this case, alcohol intoxication aggravates a violent offence, which means you can be considered to be more culpable for the offence and therefore receive a harsher sentence. However, analysis of Crown Court sentencing survey data from Carly Lightowners has shown that this aggravation is not applied kind of neutrally in any sense, and in fact women are subject to it to a greater degree than men. They suggest because women are sort of seen as transgressing norms around femininity and drinking on top of the norms around criminal behaviour and things like this. So they're kind of loaded up in that sense, and they're receiving these heavier sentences. Another example is Section 60 suspicionless searches. So in England and Wales, if the police want to conduct a stop and search, they usually need to have what's known as reasonable grounds, which means sort of a separate, sensible person would look at their reason for searching someone and say, yeah, that seems fair. And these grounds can't be based on protected characteristics. So it's meant to be a protection against, you know, unnecessary searches and biased kind of policing practices. But Section 60 searches are a special type of search that are suspicionless. So there can be a Section 60 placed over a specific area for a specific time, so maybe say 24 hours or 48 hours, and in that time any officer can search any person without this need for reasonable suspicion. And the power was originally one that was used to target football fans when there were concerns around violence and disorder at games, which is obviously very closely linked to concerns around drinking. However, the power and how it's used has really morphed over the years, and now it's tended to target violent crime. The fine rate is pretty low for that, but what is quite concerning is the degree to which these searches are exacerbate racial disparities. So as you can see from the figures I've shared, in the most recent year, Black people were stopped at roughly 7 times the rate of white people under this power, which is higher than the stop and search disparity for all kinds of searches, which is around 4. But this disparity for this specific power has been really variable and has been much higher in recent memory. So in 2018, 2019, Black people were 45 times. Were stopped at 45 times the rate of white people under this power. So these are, I hope these are 2 examples that show maybe how addressing alcohol-related violence through the criminal justice system can either morph and take on kind of new targets or go beyond their original intentions, or can kind of serve to further contribute to the inequalities already so prevalent in the criminal justice system. The other point worth thinking about when we consider whether we should be using criminal justice interventions to address alcohol-related violence is what these interventions really don't touch. And that I would describe as an environment that is at least in part co-created by the alcohol industry, a global alcohol industry, and the bodies that regulate it. So myself and Carly Lightowners recently conducted investigation using British Crime Survey for England and Wales data for a 5-year period to look at who was experiencing alcohol-related violence. And what we found is that this victimisation falls really disproportionately on lower socioeconomic groups. In some ways, that's not surprising because there are other alcohol-related harms like alcohol-related mortality and alcohol-related illnesses that fall more heavily on those groups, despite those groups drinking less on average. And also we know this is a pattern for victimization, violent victimization, kind of full stop. So it's not a particularly surprising finding, but when we tie it together with what we know about where alcohol outlets are positioned, we know these cluster in the most deprived neighbourhoods. So this recent work from Scotland, for example, found that across the country, the most deprived neighbourhoods were home to 40% more alcohol outlets of any kind than the least deprived neighbourhoods, and almost double the number of off-sale outlets. So those are those kinds of supermarkets and shops that I was mentioning before that we might think of as particularly relevant for violence in the home, as opposed to violence in public, perhaps. There are, of course, also harms that we might not recognise as violence, but we could think about through that lens, related to alcohol, that, of course, the criminal justice system, with their focus on the individual and on public violence, these really are not in their purview. So just to sort of give you some kind of background, there were 3 million global deaths linked to alcohol in 2022, and alcohol was the cause of a really high proportion of deaths of those aged 20 to 39. So that's nearly a sixth of all deaths in that age range in that year. There are also nearly 750,000 cancer cases linked to alcohol globally, because alcohol is linked to 7 different kinds of cancer. But the alcohol industry has been described as misleading the public on this alcohol and cancer link. So Mark Pettigrew and colleagues looked at alcohol industry SAPRO, so that's kind of maybe charitable bodies that promote public health messaging on behalf of the alcohol industry, and they found various tactics which obscured this alcohol cancer link. So this included denying and disputing the evidence, so that might mean just not mentioning cancer at all in their health promotion materials. They would also misrepresent or obfuscate the risk. One example would be like suggesting that there isn't scientific consensus where there perhaps is. And finally, they would just move the discussion away from alcohol as a risk factor. So they would instead kind of, one thing they were found to do was to highlight other risk factors ahead of alcohol, such as your gender perhaps being a risk factor for developing breast cancer, for example, to kind of just muddy the message. Based on this, the issues I've kind of outlined here, I'm currently developing a toolkit that is intended to be used by what we could kind of loosely term the alcohol policy sector. So that's all these different kinds of bodies that may either enact alcohol policy or in some way support or contribute to it. So things like charities and NGOs that might lobby government, they might conduct research or public information campaigns. Researchers like ourselves, where we are, well, myself on this topic, where we're calling for specific policies kind of as a response to our own research findings. Alliances and networks and individual campaigners, but also public services and local and national political actors. This is intended to represent a series of questions that allow these actors to kind of explore the potential for any policy response they're investigating, but specifically a criminal justice policy response, to ask whether there are ways in which they might create harm to those punished, to maintain the inequalities I spoke about before, or that these tactics and powers might morph over time and go beyond how they're kind of originally conceiving them. That's everything I have. I'm really happy that Madeline is with us, because her research is a really prescient example of some of the issues I've spoken about here from a US context. So I'd be really happy to hand over now. Perfect. Hi.
Hello. Just to get started here, so my name is Madeline Stenersen. I'm here in St. Louis, Missouri, where it is slightly early, but we're getting up for the day right now. It's becoming light outside. And I'm in the Department of Psychology. I'm an assistant professor right now. And like was mentioned, my work a lot of the times focuses on health disparities and violence prevention, but my sort of clinical heart and epidemiological work really focuses on substance use. I was a substance use counselor for a long while, and so just kind of going through that system, and really a lot of the work that I did was substance use that was often, or substance use treatment that was often involved with the criminal justice system, and really seeing that interplay. So I'm really excited to be here today to talk to you a little bit about a recent project that we did involving racial and ethnic disparities in specifically alcohol treatment referral and outcomes in the United States. We used a large data set and had some really kind of interesting findings. So just to start with a little bit of a background, now I don't assume that I don't know as much about, besides what Lucy has told me, about the criminal justice system or the substance use treatment sort of interplay anywhere else in the world besides the United States. But based on what Lucy's even just presented this morning, it sounds like we're sort of grappling with some of the similar context and issues, right? Racial, ethnic, and gender disparities especially. And so in the United States, it's a very similar story to what Lucy was just saying. Alcohol use in the criminal justice system are really, really interconnected. And so when somebody is charged, arrested, accused of some kind of alcohol-related crime or public intoxication, anything like that, they are often required by their sentence to complete substance use treatment. And that can take many, many different forms. It is often through the kind of suggestion or recommendation of a clinician, whatever that looks like, but sometimes it's the probation and parole officer that will be like, you have to go to this treatment method for this many days and you have to complete these specific things. And there are significant consequences to not completing those things. So a lot of people will, like in the forensic substance use treatment space where I was at, a lot of the time we would say people could leave anytime. They were not imprisoned in substance use treatment, but there were significant consequences for them not to complete substance use treatment in the way that was defined by their sentence. And what we've seen, at least here in the United States, is that among treatment providers and a lot of scholars, less so more recently, but historically, a lot of research has kind of shared this quote unquote positive impact of criminal justice on treatment completion for substance use. We have seen multiple studies across time periods that say people who are referred by the criminal justice system are more likely to complete treatment. Now, we know that completing treatment isn't always the only goal, right, of substance use treatment, right? We would like some sort of longer term, maybe internal kind of goals to be met rather than just sort of signing off on completion. But that is kind of what's been out there, is that there's this positive relationship between, okay, if you're referred by the criminal justice system, you're more likely to complete treatment. And it's largely been theorized to be this sort of accountability check, right? If you have somebody watching your shoulder, if you have significant consequences to not completing treatment, you're more likely to complete treatment. It's also been sort of used as this argument for more involvement of the criminal justice system in the way that it currently is involved, right? This sort of big brother kind of check and significant consequences interplay. So that's kind of been established for like a while. However, I will note, obviously, that this also ignores a lot of the negative impacts of just criminal justice involvement in general, right? Significant discrimination based on income, or sorry, for occupation, for schooling, a lot of different things like that. And then just the difficulty in the requirements for things like probation and parole can be really immense. And similar in the United States, people of color faced disproportionate consequences related to alcohol, like so including arrests related to alcohol. Lucy spoke to a lot of this already, but we just see this massive inequity in not necessarily the use of alcohol or even crimes related to alcohol, but the punishment that is instilled on people of color compared to their white counterparts. So we really wanted to kind of like come back and see, how do people get to substance use treatment, and what role does the criminal justice system play, and how does that racial inequity like manifest itself or not in this kind of referral relationship. So little research has kind of examined this racial influences, I should say racial disparities on criminal justice referral and alcohol treatment, and then how that referral, that criminal justice referral, impacts outcomes in treatment. So we had two main aims with this study. The first one is, does likelihood of criminal justice referral to alcohol use treatment differ by race and ethnicity, right? So are different racial and ethnic groups more likely to be referred to alcohol use treatment by the criminal justice system compared to other groups? And then the follow-up question to that is like, is the relationship between criminal justice referral and treatment completion, right, that generally considered quote unquote positive relationship, moderated by race and ethnicity, sorry. So does that referral of criminal justice, again, quote unquote, benefit every racial and ethnic group equally when talking about treatment completion, as has been kind of stated in broad literature? So to look at this, we used a data set called the Treatment Episodes Dataset Discharge. So this comes out of it's a federally collected data set out of the Substance Abuse and Mental Health Services Administration here in the United States. And it collects data every year for every federally funded substance use treatment facility. That's inpatient, outpatient, residential, ambulance, sort of ambulatory sort of services, everything like that. So they collect a lot of data, and it is generally basic data. It's not a huge variable list, but it does have several million people in it. So our study looked at cases of discharge from alcohol treatment from 2015 to 2019. So all of this stuff is pre-COVID. We are planning to do a follow-up, but just to give you all that context as well, because that all happened. And one of the main things, I have all of my tables at the end if there's more details as far as methodology goes, or the specific data, but just for our main purposes, the criminal justice system referral kind of refers to a lot of different things and is self-identified by the substance use treatment facility. So DUI court, probation, parole, things like that, all of that are encompassing what I'm calling criminal justice system referral or criminal justice referral, right? Non-criminal justice referral is everything else, right? So the majority of cases outside of the criminal justice system are referred by self, right? So the person, through their own volition, comes to substance use treatment, right? But this category can also include other treatment providers referring people to substance use treatment, healthcare providers, school systems, like maybe a higher education school system. All of these are adults referring people to substance use treatment. So those are two main categories we kind of wanted to see the differences. So the statistical analysis followed the specific aims. So first, looking at, does likelihood of criminal justice referral differ by race and ethnicity, right? The first thing we did was we conducted an ANOVA primarily to get the estimated marginal mean differences when controlling for other sociodemographic factors. That is the estimated marginal mean in the likelihood of criminal justice referral. So the likelihood of being referred by the criminal justice system based on race and ethnicity for 4 different groups. And then our subsequent logistic regression analysis examined the relationship between race and ethnicity and the criminal justice referral. So could we predict whether somebody was going to be referred by the criminal justice system based on their racial or ethnic group? And one of the things we also wanted to do was sort of expand on this idea of how race and ethnicity is looked at in these contexts. And so what we did is, this is not intersectionality has been used in a lot of different ways. We are calling it an intersectional logistic regression analysis, but I want to explain what that means, because really what we wanted to look at is not just using white as a reference category, right? Going beyond white as a reference category, we have enough people, right? And so instead we ran a series of logistic regressions, changing that reference category. And so what that led to is we were able to compare not just Black individuals to white individuals and Asian American individuals to white individuals and Alaska Native and American Indian individuals to white individuals, but we were also able to compare Black individuals to Asian American individuals and American Indian and Alaska Native individuals to Black individuals and so on. So there's more comparisons there, sort of stepping out of the kind of idea that it's all just compared to white. So you'll see that in our analyses, it's just kind of a little bit of a more complex step that we took. And then the second analysis mirrored the first analysis, but it was done primarily it was a moderation, so it was done a little bit differently. Again, the question being, does the relationship between the criminal justice referral and treatment completion differ based on race and ethnicity, or is it moderated by race and ethnicity, to say it a different way? So we did the logistic regression examining the relationship between criminal justice referral and treatment completion, moderated by race and ethnicity, and then we did, I'm sorry, my numbers are off. We did the subsequent intersectional analyses examining the differences between all of those racial and ethnic groups. So that's kind of what this looks like here. This is that moderation analysis, really seeing if that association is the thing that differs based on group. So what we found, again, I'll break this up by kind of our aims. The first one, again, who's referred to treatment by the criminal justice system. We found significant differences. Specifically, race and ethnicity was significantly predictive of the likelihood of being referred to treatment by the criminal justice system. Just in our basic sort of white as reference category analysis. So it was a significant factor overall. And then when we looked in subsequent comparisons and subsequent analyses, we found that American Indian and Alaska Native individuals were twice as likely to be referred by the criminal justice system compared to all other racial and ethnic groups. Now, you'll notice this graph here on the right that their bar isn't twice as high, but this is the estimated marginal mean of being referred. So it's a little bit of a different statistic. But when we look at the odds ratios, when we look at the amount that they are more likely, it's about twice as likely as every single other group, that they are more likely, they're twice as likely to be referred by the criminal justice system. You'll also see that the differences between the groups are significant. So the only non-significant differences are the difference between Black and white individuals in the likelihood of being referred. I will say, just given the amount of information that we know about discrimination, oppression, and marginalization of Black individuals by the criminal justice system, this was a surprising outcome, and the disproportionate impact that the criminal justice system has on the lives of Black individuals in the United States. But it also was specific to alcohol treatment. And so for us, we couldn't really kind of identify the scope of why this happened as far as that specific Black and white non-significance, but it was a surprising finding for us. And then when we looked at, let me just double check our time here. When we looked at criminal justice referral to the, whether criminal justice referral to treatment completion was moderated by race and ethnicity, we did find that for everybody except for American Indian and Alaska Native people, the criminal justice system referral was associated with higher likelihood of treatment completion compared to other referral sources. So this is what other literature in the past has stated, right? Criminal justice referral is associated with a higher likelihood of treatment completion. That was true for all except for American Indian and Alaska Native people. For that group, referral to the criminal justice system, from whatever source, was not significant in predicting treatment completion. So the criminal justice referral did not, quote unquote, benefit this group. in predicting treatment completion. They were no more or less likely to complete treatment regardless of their referral, right? And we actually found, so this does not mean that this group had like significantly lower treatment completion rates. What it meant is that American Indian and Alaska Native people who were not referred by the criminal justice system had another source of referral. Those completion rates mirrored other groups who were referred by the criminal justice system. So you'll see these bars here that that sort of light bar on the right-hand side for American Indian and Alaska Native individuals is not insignificantly different from the criminal justice referral bars, so the darker bars for every group. So something is happening here where non-criminal justice referrals are, to use the sort of term related to this study, are as quote unquote beneficial as the criminal justice referral source. So what we took away from this is that, again, significant racial and ethnic disparities exist in who is referred by the criminal justice system. And again, obviously our analyses and results really focused on the phenomenon that was happening among American Indian and Alaska Native people and being twice as likely to be referred by the criminal justice system. In examining this effect in the context of a lot of other literature, it's really theorized that this is an effect of an overall historic and continued oppression of this group and heavy involvement of specifically the federal government in the lives of American Indian and Alaska Native people. We also take away that these benefits of the criminal justice referral when talking specifically about treatment completion do not apply to all. Right? That's not a statement that we can necessarily make that applies to everybody, that criminal justice referral will mean that they're more likely to complete treatment. We can say this because we found that effect, among American Indian and Alaska Native people who, even though they were twice as likely to be referred by the criminal justice system, really found the least amount of benefit from being referred to by the criminal justice system. So just a couple of implications here. I don't want to go over my time, but for researchers, just really looking at exploring and funding non-criminal justice referral sources as a potential way to promote treatment completion and recovery, right? As well as exploring the consequences of criminal justice referral, as well as what we consider those benefits. And then for clinicians, leveraging different sort of family supports, connections, culturally sensitive treatment methods, and addressing and acknowledging social and systemic barriers in treatment. And then policymakers would benefit from exploring, again, that decoupling of alcohol treatment from criminal justice involvement, and seeing what that could look like, even just exploring the ideas around that. And then implementing policies to reduce bias and overrepresentation of people of color in the criminal justice system. So I'm going to fly through this. A couple of limitations here. Obviously, I said at the beginning that treatment completion is not our only desired outcome. So, and then I told you about a study about treatment completion, right? So I want to fully acknowledge that this is not the full scope of what we're looking for when somebody is graduating or completing substance use treatment, right? Longitudinal follow-up data and research is really necessary to see if people reach their recovery goals. We also need information on different types of criminal justice referral, right? So there was no, even though almost all criminal justice referral would be considered mandatory in a way, we didn't have data on whether it was considered legally mandatory for somebody to complete treatment or not. And then federally collected data is messy, right? And so taking the situation and context into consideration, that this is a required form that all federally funded substance use treatment facilities are required to fill out. So taking that within the limitations of its context too. And that is what I have. So I'm happy to take any questions. That's the article that was published that brought Lucy and me together on this data and on this topic. And so thank you so much.